I should move back a little, I think. Okay. You ready? Look, we're in there. What? Okay. Hi, I'm Cindy. I'm going to be your nurse practitioner student today. Today, I am going to do a head-to-toe assessment, and I'm going to be describing what I'm doing and telling you what I'm doing as I do it for you and the instructors. If you have any questions or if anything hurts, please let me know. So the first thing I'm doing, I'm looking at your overall well-being and your emotional well-being. It doesn't look like you're in any acute distress, and it looks like you're well, appropriately dressed. So the next thing that I'm going to do is I'm going to be always observing your skin during the exam. I'm looking for any lesions, I'm looking for any rashes, I'm looking for color, texture, moisture trigger, scars, and hair distribution patterns. So the first thing I'm going to have you do is put your hands out like this. I'm going to assess your fingers, let me know if anything hurts. Good, anything there? No? Good, so I'm going to be checking cap fill, and cap refill is brisk at 3+. Next, I'm gonna go ahead and have you do this for me, looking for the little window, good, so no clubbing in the nails. Now I'm gonna do your radial pulses, feeling for rate rhythm and symmetry, about 72 rate regular, 2+ out of 4, and they're symmetrical. Next, I am going to feel your wrist. Any pain there?
No.
Any pain there?
No.
No. Okay, so I'm going to go up your arm, up to your elbow or your olecranon process. Any pain there?
No.
Going all the way up to the glenohumeral joint, feeling, palpating there. Anything?
No.
Okay, going up, feeling your olecranon, going all the way up to the glenohumeral joint. Any pain?
No.
All right, bilateral arms, no bony abnormalities or no issues with the skin. So the next thing I'm gonna do is have you grip my fingers and we're just gonna test strength. Good, resist against me, 5 out of 5 on the strength. Then I'm gonna do some range of motion exercises. The first thing I'm gonna have you do is just follow me, hands out like this. I'm gonna have you go ahead and pronate, supinate, and then we're gonna do some flexion and extension. Good. So normal range of motion of the lower extremities, the wrist, and the elbows. So now we're going to do some arm range of motion. First thing I'm going to have you do is just follow me, arms out straight. I'm going to have you go cross your arms all the way over your body. So that's this adduction, all the way back, abduction. Then I'm going to have you put your arms straight out. We're going to supinate and pronate. Good. And then we're going to do some external rotation by putting your hands behind your back. I'm going to be looking up to see how far. Good range of motion. And then we're going to do internal rotation like this. Good. So again, looking good range of motion. So full range of motion of the shoulders. Okay. So now we're going to go on to your hair. Here I am looking at your hair distribution pattern, looking for any rashes, any infestations. I don't see any. Next, we're going to go on to your eyes. Here I'm looking for any lid lag. I'm looking for exophthalmos. I'm also looking for edema, none of which that I see. All right. Then the next thing I'm going to do, we're going to test cranial nerve, 3 oculomotor, 4 trochlear, and 6 abducis. I am going to have you watch my finger and just with your eyes follow my finger. Here I'm looking for any nystagmus, pausing at each endpoint. Good, so no nystagmus noted. Next we're going to do convergence. And I'm going to have you look here, and then I'm going to have you look all the way out. And then look here again, and all the way out again. Looking at your pupil response, you had dilated pupils for far distance and constricted pupils for near distance, which all that indicates that your cranial nerve 3, 4, and 6 are intact. Now what I'm going to do is I'm going to check your sclera, and I'm going to check here. Go ahead and look up. Side to side, good, and down. Okay, we're going to do the other side, up, side, and down. Good, so clear conjunctiva and sclera is white. All right, so next thing I want to do is I'm going to check your pupillary response for cranial nerve 2, optic 3, oculomotor, looking for your pupils. Good. Direct and consensual, so positive, direct, and consensual response to the pupils. Pupils are about 4 millimeters round and equal. And do you wear glasses or contact lenses?
Glasses.
Glasses, okay. So the next thing I need to do is look, do the fundoscopic exam. I'm going to be looking at the back of your eye. I'm going to have you look straight out at the wall there. All right. I see the red reflex coming in. Looking at all 4 corners of the eye, good. Gonna go on to the other side. Go ahead and look straight out. Again, looking for that red reflex. Coming in. Looking at all 4 corners, good. So I was able to visualize the optic disc. It had sharp margins and it had no AV nicking, no hemorrhage, no lesions noted. Okay, so now we're going to go on to the next part of the examination. Here, I am going to go to your ears and we're going to do something called the whisper test. So I'm going to have you plug your ear here and I'm going to have you repeat after me.
1, 3, 6.
Good. Other ear.
Seattle.
Seattle. So good. All right. He was able to repeat both of the whispered words and letters. And so that indicates that his acoustic cranial nerve 8 is intact. Now we are going to go on to just feeling the tragus. Any redness? No redness, no swelling, any pain there on the auricular? No. Or auricle. So there's no redness, no swelling. No pain. So I'm going to go ahead and I'm going to look in your ears. I'm going to be bracing here, 3-point bracing. Good. I'm going to go on to the other side. Again, doing my 3-point bracing. Good. So I was able to we'll look at both the optic discs on both sides, which was pearly gray, no cerumen in your ears. There was bony prominences were visible, cone of light was visible on both sides, and there was no redness of the ear. So next, I'm going to look in your nose, okay? And I'm going to have you just slightly tip your head up, good. Good. And good. All right, so there I was able to visualize the turbinates, which were non-boggy bilaterally. The septum was non-deviated midline, no mucus, and no polyps noted. Do you have any problem smelling coffee in the morning when it's being brewed?
No.
No, so that indicates that your cranial nerve 1 olfactory is intact. Now we're going to go onto your mouth. I'm going to pretend like I have a tongue blade. I'm going to be looking in your mouth here. Go ahead and open up, looking, inspecting your mouth. Go ahead and lift up your tongue. Good. So no dental caries, no lesions, no lumps, no leukoplakia. Now I want you to go ahead and stick out your tongue all the way and say, ah, good. So I was able to visualize the uvula that was midline and it rose and fell. The soft palate rose and fell symmetrically, indicating that your vagus nerve 10 is intact. Now I'm going to go ahead and have you stick out your tongue. Good. Move it from side to side. Good. So tongue is midline and full range of motion, which indicates that cranial nerve 12 hypoglossal is intact. Do you have any problems tasting food or any changes in your tasting? So no changes in food. So that indicates that cranial nerve 7, facial and cranial nerve 9. So facial 7, cranial, 9 is glossopharyngeal. Both are intact. All right. Now I'm going to go ahead and I am going to palpate your mouth, and I'm just going to stimulate this because I don't have any gloves left. So I'm gonna have you stick out your tongue. I'm gonna feel your tongue on both sides. I'm also gonna be feeling your lips for any lesions, looking for any cold sores. Gonna be feeling both sides of your mouth, the upper hard palate, under the tongue for any lumps, none noted. So no lumps, no lesions, no abnormalities palpated in the mouth. All right, now we're gonna go on to cranial nerve 5. Cranial nerve 5 is the trigeminal nerve. With this, I'm going to palpate here. Go ahead and tighten your jaw. Good muscle strength, 5 out of 5. Gonna go down to the TM, and I want you to open and close your mouth. Good, good. One more time. Good, and no palpable crepitus, no audible clicking indicated in the jaw. So cranial nerve 5, trigeminal intact. Next, we're going to go on to cranial nerve 7. This is the facial. So I'm going to go ahead and have you lift your eyebrows up for me. Good. Close your eyes, and I'm going to resist against me opening. Good. So 5 out of 5 on strength. I'm going to have you smile now. Good. Show me all your teeth. Frown. Puff out your cheeks. Good. So that indicates that cranial nerve 7 is intact. Your face is symmetrical, and now we're going to go on to cranial nerve 11, which is the spinal accessory muscle. Here I'm going to have you resist against me with your trapezius muscle. Good, 5 out of 5 strength. I'm going to go ahead and have you push your cheek against my hand. Good strength, 5 out of 5. Good strength there, 5 out of 5. That was the sternomastoid muscle, so good strength, indicating that your cranial nerve number 11 is intact. All right. So now that we have finished the cranial nerves, I'm going to go on to the lymph nodes. I'm going to do the pre-auricular, post-auricular, the occipital, good, going on to the tonsillar, the submandibular, submental, just feeling here. Going to do the superficial cervical, the deep cervical chain, the posterior cervical, going on to supraclavicular, just feeling any pain with any of this.
No.
At all? No. Okay, so, and then I'm going to do the central axillary nodes, so don't forget up in your armpit. Sorry, this might hurt. Not feeling any nodes there. Going to come around to the other side. Just relax your arm. Going to be feeling in a downward motion, and no palpable nodes there. So nothing greater than 1 centimeter. If there was any, I was feeling if they were hard, if they were fixed, if they were firm or tender, or any swelling or redness. All right, so now we're going to go on to your trachea. With this, I have a cup of water. I'm going to have you, and I'm going to use my light because I have a hard time seeing in here. So go ahead and just take a sip of water, and then I'm going to want you to swallow for me. Good. So trachea is midline and no swelling noted. I'm going to actually have you hold that again. Now I'm going to come around and I'm going to check your thyroid. So I'm going to come behind you. I'm going to be putting my hands around your neck, and I'm going to be feeling for your thyroid gland. All right, go ahead and take a sip of your water and swallow for me. Good. And I'm displacing each of the lobes of the thyroid and feeling. So no nodules, no swelling, any tenderness when I did that?
No.
No. So no abnormalities of the thyroid gland noted. Now I'm going to go ahead and I'm going to palpate your spinal column, feeling for any drop-offs here. Any pain when I push on this?
No.
No, good. Okay, so now we're going to go on to the paravertebral muscles. Going to feel all the way down here. I'm looking for any spasms, any knots, any pain. Any problems there, Brooks? No.
No.
All right, so now the next thing that I'll have you do is take a nice deep breath in and out for me. Through your mouth, good. So rise and fall of the chest was symmetrical. I'm going to have you sit up a little so I can get my hands at the T10. Going to go ahead and deep breath in and out, good. And Excellent. So hands, Rosenfeld symmetrical, indicating good chest expansion on both sides. I'm going to be looking at your AP diameter while I'm grabbing my stethoscope. Your AP is half the size of your lateral diameter, which indicates no chest or abnormalities. I'm going to be testing your lung sounds. I'm going to have you take a deep breath in and out throughout your mouth, okay? Every time I touch you with my stethoscope. Good. You doing okay? Okay, and now I am also going to do the right middle lobe. Deep breath in and out. And one more time for me. Good. So right middle lobe was clear to auscultation. Throughout the lung fields, I did not hear any wheezing, rales, crackles, bronchi, and everything was clear and equal breath sounds. Now I'm going to come around to the front and we're going to just do the same to the front here. Going to have you take another deep breath in and out. And again for me. Again. 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 One more. And one more. Good. So again, clear lung sounds, no bronchi, no wheezing, no rales, no crackles. All right, now I'm going to go ahead. I'm going to listen to your heart sounds here. Here, I'm just going to have you breathe normally, okay? So first, I'm going to go to second intercostal space on the right, listening to the aorta. Going to go across to the left, second intercostal space, listening to pulmonic. Then I'm going down to 3, 4, and 5, listening for the tricuspid as well as the right ventricle. Going to the fifth intercostal space, mid-clavicular, listening for the mitral valve as well as the left ventricle. Good. So I am also going to check now for your PMI or your apical impulse. Again, fifth intercostal phase, mid-clavicular feeling. It's non-displaced or non-enlarged. Good. The good rate of like maybe 72, 2 plus in amplitude, and it's regular. Okay, doing your lung sounds, done that. Alrighty. So now, Brooks, the next thing we're going to have you do is we're going to inspect your breast. All right. So with your breast, I am going to go ahead and have you put your hands on your hips. Just kind of puff out your chest a little bit. I'm looking at your breasts. I'm looking if they're symmetrical. Go ahead and hands over the head, looking for any dimpling, any nipple retraction, looking for any orange peel sign, the symmetry, size, shape, contour, lumps. Good. So no abnormalities found there. From here, Brooks, I'm going to have you lay down on the couch, and I'm going to do the manual exam of your breast. All right, so Brooks, here I'm going to be just doing about 2 inches above you just for modesty purposes. I'm going to have you put your hand above your head. Let me get the dog out of here. So I would normally be standing. Here I am going to be using my 3 fingers in a circular motion, starting in the tail of stents, working in a horizontal pattern, doing light, medium, and deep, going all the way up to the clavicle, feeling the breast tissue, making sure that I'm not missing any breast tissue as I'm doing this exam. I'm gonna go up past the nipple, making sure there is no, I'm sorry, I'm supposed to be simulating this above you. Making sure that there is no nipple drainage, and then as I get to the sternal border, I'll be done. Then I would come around to the other side, but because we're at the couch, I can't do that. I'm gonna have you put your arm down, other arm up. Oh my God, you dogs. Okay, again, starting in the tail of stents, in my circular motion, light, medium, deep pressure, light, medium, deep in each section, feeling in a horizontal pattern, going all the way to the end of the breast tissue, looking at the nipple, make sure there's no drainage. Gonna go ahead and go all the way up to the clavicle, all the way down, making sure that I'm not missing any tissue. Once I get to the sternal border, I'm done. So I did not feel any lumps. The tissue was soft. Did you have any pain when I did that? So no pain noted. Okay, next we're gonna go on to your carotids. I'm gonna be feeling them one at a time. Rate rhythm, amplitude, good, so it's about 72, 2 out of 4, regular. Gonna feel on the other side. Again, 72, regular, amplitude, 2 plus out of 4. Now I'm gonna be listening for any bruise using the bell of my stethoscope. Go ahead and hold your breath. And another one. Good. So no bruise noted. Now I'm going to go on to assessing your heart sounds for any murmurs. Again, second intercostal space on the right. Good. Going over to the left, second intercostal space. And first was the aortic, now I'm on the pulmonic, going down to 3, 4, and 5 for tricuspid. And then going on to the 5th intercostal space, midclavicular, listening for mitral. No murmurs noted. Now I'm going to go down to your arteries, your aorta first. Listening here. And I go on to the renal. Other renal, going down to the iliac. And then again to the iliac. And no bruise noted there. All right, now I'm going to be listening in all 4 quadrants for bowel tones. Good, gurgling in all 4 quadrants, normal active. Now I'm going to be looking at the shape of looking at your abdomen. And sort of, if I pull up your shirt. So here I'm using my light. I'm looking for any striations. I'm looking for any hernias. I'm looking for venous pattern, and I don't see any of those. I don't see any abnormalities in the abdomen. I'm also going to be looking at the pericardium for any heaves. So no abnormalities of the chest noted. All right, so now I'm going to go ahead and percuss. I'm going to be percussing in all 9, all 9 regions of the abdomen. Good, so tympanic or tympany everywhere except right down here where the sigmoid colon was, it was a little bit dull, and that is normal. So next I'm going to do some palpation. First I'm going to start with light palpation. Do you have any pain anywhere in your abdomen? Please let me know if anything hurts. So about 1 centimeter in all 9 regions, just feeling for any masses or lumps. Again, looking at them, the skin and the venous pattern. Good, nothing noted on light palpation. Now I'm going to go to deep. So about 3 centimeters in here. Any pain at all? And looking at Brooks's face to make sure he's not having any pain. All right, so no pain there noted, and no lumps noted. Now I'm going to be checking the size of your liver. So go ahead and take a deep breath in for me. Good, now I'm going to just have you do it one more time. Good, no palpable liver. All right, going to go over here to the spleen. Go ahead, deep breath in and out. Deep breath in and out for me. Good. So no palpable spleen. All right. So I'm going to put your shirt down, going down to the femoral arteries, feeling for rate rhythm, amplitude and symmetry. So 2 plus, rate is 72. So 2 plus out of 4, rate is 72. Symmetrical and regular. Then I'm going to be checking here for any lymph nodes, inguinal lymph nodes, no inguinal lymph nodes noted. And I'm going to be going down your legs, inspecting, looking at muscle mass and symmetry, feeling for any abnormalities, feeling the first the quad, then the patella, going down the shin. Then I am going to be also feeling the calf for anything. Any pain in the calf?
No.
Also going to be pushing in here at the shin, looking for any pitting edema. No pitting edema noted. All right, going down the quad, going to the patella. No problems there. Going down the shin. Any pain, Brooks?
Nope.
How about in the calf? No redness, no tenderness in the calf. Gonna look for that edema again. No pitting edema. Now I'm gonna go down to the feet and just palpate the feet. Let me know if anything hurts here. Anything bothersome there? No, so we're gonna pretend like your socks are off. I'm gonna be feeling for your pedal dorsalis pulse. Good. Excellent. So rate of about 72, 2+ out of 4, regular and symmetrical. Now we're going to do range of motion exercises of your ankle. So I'm going to go ahead and have you do some dorsal flexion, which is pulling your toes up towards your face. Then I'm going to have you point them out down towards the computer. That is going to be plantar flexion. Then I'm going to have you touch your toes together, eversion. Then I'm going to try to have you touch the soles of your feet together, inversion. Great. Now I want to do some range of motion of your hips. First, I'm going to make sure that your hips are okay and your knees. So this is passive range of motion, so I'm going to be doing the work. First, I am going to be bending your knee up for flexion. Good. And then we're going to extend it out. And then I'm going to do adduction, abduction. And then I'm going to just check for rotation of the hips. We're going to do some external rotation, internal rotation, good, full range of motion there. I'm going to do the other hip, first doing the flexion, good, extension, and then we're going to go to adduction, abduction, and then again checking that hip for external rotation, internal. Wait, I need your knee to bend. Internal rotation, good. So full range of motion on the bilateral hips. Okay, now Brooks, I'm gonna go ahead and have you sit up. We're gonna do something, the cerebellar test, and this is called the rapid movement test. So I'm going to have you put your palms and then your backs of your hands, palms back of your hand. Good. Do that a few times. Great. So that's good. So basically you were smooth. You were had no problem doing that. So good cerebellar response. Next, I want to go ahead and check your reflexes. And the first thing I'm going to do here is I'm going to check your bicep. Good, so 2+ there. Then I'm going to go down to the brachial radial. And normally I would not have a shirt on here. And then we're going to go, and that was 2+, going to go to your tricep. Good, 2+ on that one. Going to go to the other arm. Again, first doing the bicep. Good, 2+ on that one. The radial dorsalis, good, or no, radial, oh my gosh, it's too late, radial something. Okay, now we're going to do your tricep. Go ahead and relax for me. And good, 2+ on the tricep. Then we're going to go ahead and do the patellar. I know you're tough, that was a 1+ probably. Nice and relaxed. Oh, there it moves, so 2+ on that one. Gonna go ahead and do the Achilles, 1+, and the other 1+. Oh, that was actually probably a 2+. I'd say a 2+. All right, so tendon reflexes are done. So now I'm gonna go ahead and have you stand up. I'm gonna be looking at your spine here at this point. First, I'm gonna be looking at the curvature of your spine. Here, I'm looking for in the cervical and the lumbar for concave and convex of the thoracic. I'm also looking for any kyphosis or lordosis, which I do not see. I'm going to go ahead and have you bend over and show me some flexion. Going to be feeling up here. No scoliosis noted, good flexion. Go ahead and stand up. And then I'm going to have you bend back. We're going to do extension, good, extension. Now we're going to check the range of motion of your spine. So here, I'm going to be holding on to you here, looking at your hips. I'm going to have you just rotate your shoulders from left to right. Good, so full range of motion there. And then we're going to do some bending. I'm going to have you run the palm of your hand down the side of your leg to your knee on one side. Good, good. Lateral bending, good. So full range of motion of the spine. Now I'm going to go ahead and have you turn around. I'm going to have you stand on one foot. And then I'm going to have you bend down a bit. We're going to look at leg strength. Good. Let's do the other leg now. And go ahead and bend down. Good. So full strength of the legs. Now I'm going to have you walk about 10 feet. And I just want to have you walk normal. This is just looking at your gait and your arm swing, looking for any leg lag, any drop foot. Go ahead and come on back. And none noted, no wide stepping. I'm going to go ahead and have you walk on your toes. Here we're looking for balance and gait and coordination. Good. Back on your heels for me. Good. So again, good coordination, good balance, good strength. Now we're going to do what's called tandem walking. So heel toe, about 4 steps. Good. So good tandem walking, which indicates good balance. Okay, so oops, I believe that is all for you. I'm going to go ahead and go on to the genital urinary for women and men. So the first thing that I'm going to talk about is male genital urinary. For the men, I'm going to wash my hands, put on my gloves. I'm going to be explaining to him what I'm doing and making sure that it's okay, getting permission. I'm going to have him stand. I'm going to be seated in front of him, and then I'm going to be with my gloves on. I'm going to be inspecting his hair and his pubis region, looking for any rashes, looking for any lesions, infestations, any abnormalities. I'm going to be looking at the skin for the color, the moisture, those types of things, redness. Looking at the shaft of his penis. Also going to go ahead and palpate down the shaft of the penis, getting to the glands where if he is not circumcised, I'm going to have him retract. I'm going to be looking at the urethral meatus. I'm looking at for any lesions. I'm looking for any drainage. Then I'm going to go on to the testicles, and those are going to be done one at a time. So I'm going to take the scrotum between my hands and just feel for any lumps, any tenderness if they might have. I'm also looking for any warmth or heat or swelling. I'm going to go up to the epididymis, feel that, following along to the spermatic cord. Once I get to the spermatic cord, I'm going to follow it up to the inguinal ring. I'm going to insert my finger in the inguinal ring, have him turn his head and cough, feeling for any bulges. If there's no bulges, that indicates that he does not have a hernia. So the next thing I would do is the same exact procedure on the other side. So each testicle would be done separately. No abnormalities here. Then after that, we're going to go to the rectal exam. So again, explaining to him what we're doing, getting permission. I am going to lubricate my index finger. He's going to be bent over the examining table. I'm going to be behind him. I'm going to have him bear down. I'm going to be looking at the anus. I'm looking for any fissures or any hemorrhoids. I am then, as he's bearing down, inserting my fingers into his rectum, feeling all the way around both the lateral and the anterior and posterior cervix, anterior, posterior, for any abnormalities such as lumps, any hemorrhoids, any pain. On the anterior portion, I'm feeling for the prostate. I'm trying to feel for the sulcus, and then each lobe, feeling for any nodules, any pain. It should feel like the tip of an eraser. I'm not going to ask the patient if he has any pains, and it should be slightly movable. Okay. Then I'm going to remove my finger from his anus and give him a Kleenex. Okay, then I'm going to go on to the female. So with the female, how's my head? So with the female, I'm going to again wash my hands, put on my gloves. I'm going to put her in the lithotomy position, draping her so that I can see her face. I am going to be explaining what I'm doing to her. First, I'm going to be inspecting her mons pubis, looking for any infestations, any rashes, any lesions. Also looking at her hair distribution pattern for the Tanner score. Then I'm going to be looking at the labia major and labia minora, and then I'm going to be also looking at the interos. I'm looking at the clitoris, as well as the urethra and the rectum or the anus. I'm looking for any hemorrhoids. From there, I'm going to be telling her what the next step is. I'm going to have my speculum soaking in water. I'm going to put a small amount of lubrication on it. Again, I've got my gloves on. I'm going to go ahead and touch the patient with my left hand on her thigh, letting her know that I'm going to bring it down to her perineum. Here I'm going to place 2 fingers at the posterior part of her vaginal vault, putting a little pressure. I'm going to insert the speculum at 45 degrees in a downward motion. Once I get it all the way in, I'm going to rotate it 45 degrees. Then I'm going to slightly open it and see if I can visualize the cervix. If I'm unable to visualize the cervix, I'm going to pull it back slightly, and then closing, once I pass the cervix, I'm going to reposition it up, open it up again. Once I visualize the cervix and the cervical os, I'm going to be looking for any bleeding, any indurations, lesions. I'm also going to be inspecting the vaginal walls for those same things. Okay, once I'm done with that, then I'm going to go ahead and pull the speculum out slightly. Once I get past the cervix, I'm going to close it all the way down, pulling it out with a downward pressure. And then I'm going to tell the patient that I'm going to be doing the bimanual exam. There, I'm going to be taking off my left glove. I'm going to lubricate my index and my middle finger. I'm going to be inserting them into the vagina. The first thing I'm going to feel for is any cervical motion tenderness. I'm going to be feeling her cervix. Also going to be feeling for any lumps on the sides of her vagina, feeling the texture of the walls of the vagina. Then I'm going to be feeling for the size of her uterus. With that, I am going to put my non-dominant hand on her abdomen, pushing down, trying to feel the size and the shape of the uterus, seeing if it's firm or fixed or if it's movable, seeing if the patient has any pain. From there, I'm going to angle my fingers towards the right, where I'm going to try to capture the adnexa with a sweeping motion. I'm going to use my non-dominant hand to catch the ovary. The patient might feel some twinge of pain. It should be about the shape of the size of an almond, and it should be movable, and there should be no nodules noted. Then I'm going to rotate to the left, do the same exact thing using that sweeping motion, feeling for the adnexa, capturing it, feeling if it's movable, tender, and then I'm going to remove my fingers from the patient's vagina, and that's the end.